In our experience as disability management experts, we found that there was a huge increase in the last few years in mental health claims. Most of our work comes from insurance companies, and it was really appalling to see the increase in mental health claims in the last few years. We've started the dialogue with things like the Not Myself Today campaign. We have actually created return to work policies as a result of being involved in the case study project, which was really important for us. We've reorganized some of our job descriptions so that we had better work load management, which of course is one of the 13 workplace factors. It was really important that people have work-life balance as well, so that's why we decided to look at things like job descriptions and the way people were working as well. So one of the things that we thought was important was to have a dialogue with our staff on a daily basis, just to check in and check out. And so our supervisor of admin has done that with our inside staff, just to make sure that people are feeling good about their work, their activities, where they are in their life. And that was a really important exercise for us, to be able to ensure that people are feeling good psychologically and that there's no reason that they can't be there, or that we're looking at the early warning signs. So it was important for us to do that fairly early on. The other thing that's very interesting for us is when we were retaining good talent, people automatically sat up in their seats and said, I want to work for an organization like this that really cares about my psychological health. And so that was really exciting for us to see that people were really interested in coming to work for AGS because we were looking after their mental health. I think, again, the way to engage staff and to make sure that you're protecting their psychological health are really subtle ways. It doesn't mean that you have to talk about mental health all day long, but if you do empowering activities and activities that bring you together, I think, again, as a small company, it's really easy to do that. You can have a lot of fun. You can do things that are off time. We've looked at doing various activities where we've been outside of the workplace, and even just going out for a pizza and a drink afterwards and checking in with one another. We're still continuing to work on our policies and procedures to ensure that we have really strong return to work plans that are related to mental health and that are very specific to that. We've continued to train our staff on first aid mental health, which has been really successful, and train the trainer as well. So those have been really successful things that we've implemented. And we're looking at doing more of that training so that we have it across the board for all employees. We have been really impressed with the increased engagement with our employees, their level of productivity, their dialogue being much more open. There's a very trusting and caring environment and mutual respect. And that's made a really big difference in our organization. I would suggest to small businesses especially to start slowly. Look for a leader that is really interested in mental health and have them create a committee of committed people that want to champion this and bring it to the forefront. Survey your employees. You'll be really interested in seeing what their feedback is, and that will really help to lead the way for you.